The responsibility to ensure that you stay healthy is on you. Yes, you who is watching the video right now. When it comes to taking good care of your health, you are on your own. Hospitals are not designed to be the primary custodians of your health. Welcome to another episode of Decoding Health. In this video, I'll go over 9 reasons why you shouldn't depend on hospitals and the entire health system when it comes to staying healthy. And at the end of the video, I'll explain certain things that you can do in order to regain control of your health before it's too late. Let's get started. Before we go any further, let me make one thing clear. I'm not saying that hospitals are bad. What I'm saying is that it's your duty to ensure that you stay healthy and not the hospitals, because they are just not designed that way. Here are my reasons. Number 1, hospitals work on a profit-driven model. Though this mostly applies to private healthcare systems, hospitals generally operate as businesses that need to maintain profitability. This profit-driven approach can sometimes overshadow patient care, leading to decisions that prioritize financial gain over the patient's best interest. For example, many hospitals charge high prices for basic services such as $100 for a bandage or $50 for a simple aspirin, which could be bought for a fraction of the cost outside the hospital. There's also overtreatment for financial gain. This overtreatment involves providing medical services that are not necessarily needed but are performed to generate revenue. This could include unnecessary surgeries, excessive diagnostic testing, or prolonged hospital stays. A patient with mild chest pain might be subjected to an array of expensive tests like MRI, CT scans, and stress tests, even when simpler, less costly tests might suffice. Sometimes patients with minor fractures might be kept in the hospital overnight for observation when they could have been safely discharged simply to bill for an extra day of hospitalization. And then there are high costs of care. The cost of healthcare in hospitals is often inflated due to a complex web of administrative fees, unnecessary services, and high markups on medications and supplies. Patients often find themselves with staggering medical bills. A good example is where an itemized hospital bill shows that a single Tylenol tablet costs $15 or a simple saline IV bag costs $100, when the actual costs are a fraction of these prices. Or a routine surgery like an appendectomy that results in a bill of tens of thousands of dollars, with various fees added for operating room time, anesthesia, and post-operative care. And some of these might be necessary, but in most cases, the fees are overinflated. The other reason is that decisions are often insurance-driven. What I mean is that insurance companies often dictate what treatments are approved based on cost rather than patient care. Hospitals may also tailor care based on what insurance will cover rather than what's best for the patient. A good example is that of a patient who might be denied a specific type of surgery or therapy simply because their insurance does not cover it, even if it is the best option for their condition. Sometimes insurance might approve only a short hospital stay after surgery, pushing hospitals to discharge patients early even if they could benefit from additional recovery time. The other reason is lack of personal attention. Due to high patient loads and staffing shortages, hospital staff may be overworked, leading to rushed or impersonal care. This can result in misdiagnoses, medication errors, or inadequate patient support. For example, a nurse in a busy ward might have to care for dozens of patients, leaving little time to provide individual attention or fully explain treatment plans to each patient. Or a doctor who might spend just a few minutes with each patient due to back-to-back appointments, resulting in patients feeling unheard or misunderstood about their concerns. Then there is a tendency by hospitals to focus on acute care and not preventive care. What I mean is that hospitals typically focus on treating acute issues that require immediate attention rather than preventing those issues from arising in the first place. This reactive approach can leave patients in a cycle of recurring problems. For example, a patient with chronic high blood pressure might repeatedly visit the hospital for complications like heart attacks or strokes, but receives little education on diet, exercise, or stress management to prevent these issues. Now, I know there are a lot of healthcare workers who go out of their way to explain these things to patients, and to you, I say continue, you are doing a good job, but generally speaking, this does not happen. Another good example is that hospitals may emphasize costly surgeries for conditions like obesity rather than promoting long-term lifestyle changes that could prevent obesity-related complications in the first place. Another important point to consider is that hospitals generally tend to overuse prescriptions. And what I mean is that hospitals often rely heavily on prescription medications to manage symptoms rather than addressing underlying causes or considering non-pharmaceutical alternatives. This can lead to overprescribing, dependency, and other side effects. For example, a patient with anxiety might be quickly prescribed sedatives or antidepressants without exploring therapy or lifestyle changes as first-line treatments. Or a patient with minor pain being prescribed strong painkillers like opioids that increase the risk of addiction when over-the-counter pain relievers or physical therapy could suffice. Now, let's look at mental health. Hospitals often under-prioritize mental health, leading to inadequate treatment of psychological issues which are fundamental to overall health. Mental health care might be fragmented or given minimal attention, thereby impacting long-term recovery. Let me give you a good example. A patient who has been admitted for a physical illness like heart disease may have underlying depression that goes unaddressed, and this leads to a situation where the overall prognosis of this patient worsens because even though the physical illness has been addressed, the underlying problem has not been addressed. Another important thing to consider is how hospital incentives are structured. Hospital staff might be incentivized through bonuses or quotas to perform certain procedures or meet specific financial targets. This can influence clinical decision-making and result in care that is driven by financial incentives rather than patient needs. For example, a surgeon might be incentivized to perform more surgeries because they are paid per procedure, leading to the recommendation of surgery even when conservative management could be sufficient. Another example is where a hospital has targets for the number of patients seen or the amount of revenue generated, thereby pressurizing doctors to prioritize volume over quality of care. Having looked at these 9 points, let's now look at point number 10, which is what you can do about all this. You can take steps to empower yourself through self-care. By taking responsibility for your own health, you can reduce your dependence on hospitals and avoid unnecessary medical interventions. Emphasizing self-care can lead to better long-term health outcomes and lower healthcare costs. For example, a person who maintains a healthy diet, exercises regularly, and manages stress may reduce their risk of chronic diseases like diabetes or heart disease, thereby minimizing hospital visits. You can also consider educating yourself about common health conditions and preventive measures that can lead to early detection and management of potential health crises, thereby reducing the need for emergency care. For more tips on healthy living, consider subscribing to my channel so that you don't miss out on my future releases. And if you enjoyed this video, click on this next one to learn another cool thing on how to care for your body.